Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. Many of you today are getting an email from New York Presbyterian. I'd like to show you the email that's been distributed today, and I want to go through it with you. So this is the email that you can see came out at about 6:18 tonight. It's from New York Presbyterian with world-class doctors from Columbia and Weill Cornell Medicine. Says, Dear valued patient, thank you for entrusting New York Presbyterian with what matters most, your health and well-being. We're honored that you chose us to be your wellness partner. We are writing today with important information regarding ongoing negotiations we are having with your insurance provider, Aetna. You may have received a letter from Aetna regarding this matter. So far, Aetna has presented an unreasonable offer, and if we are unable to reach an agreement, how Aetna covers services provided by New York Presbyterian hospitals as well as New York Presbyterian Medical Group clinical practices would be impacted. We remain hopeful that Aetna will continue to engage in good faith negotiations to reach a reasonable offer that puts patients first. What this means for you. If we are unable to reach an agreement by March 31, starting April 1st of 2024, all New York Presbyterian hospitals and its clinic practices that are part of New York Presbyterian medical groups will be considered out-of-network providers for Aetna members. Please note that care from Columbia doctors and Weill Cornell medicine providers is not immediately impacted by the April 1, 2024 expiration, regardless of their office location. Their care will be delivered in-network through May 31 of 2024. If you are a New York Presbyterian employee or retiree, you will receive a separate communication detailing what this means for you. Please visit www.nyp.org/Aetna for more information. What you can do. We are currently in the middle of annual Medicare Advantage open enrollment period for those already enrolled in the plan, which is January 1st through March 31st. To continue your in-network coverage, you may want to consider choosing coverage from one of the following insurance companies currently contracted: Emblem Health, HIP GHI, Empire Blue Cross Blue Shield, Fidelis, Health First, MVP Healthcare, Oxford, United Healthcare, and WellCare. Not all of the above-mentioned health insurance plans and companies are accepted at all Presbyterian locations and affiliated practices. Please check with your doctor's office to determine which plans they participate in. Our mission. We at New York Presbyterian believe everyone deserves access to the very best healthcare services. In fact, that belief is at the heart of our mission as caregivers. We also strongly believe that everyone should be able to choose their doctors and where they receive care. Hallelujah, Presbyterian. We hope to reach an agreement to ensure your coverage remains uninterrupted. What happens next? At this time, there is no change in your health insurance coverage from Aetna. You still have in-network access at the locations listed below, and with providers currently accepting Aetna through March 31 of 2024, including Columbia Doctors, Weill Cornell Medicine, and New York Presbyterian Medical Group clinical practices. As mentioned, the care from Columbia Doctors and Weill Cornell Medicine providers is not immediately impacted by the April 1, 2024 expiration regardless of their office location. Their care will be delivered in network through May 31 of 24. We will continue to keep you informed as our negotiations progress. In the meantime, we have set up dedicated resources to provide additional information if you have questions. For more information, please visit www.nyp.org/Aetna. Email us at nyp_Aetna@nyp.org or call us at 646-697-2386. We thank you for your support and trusting us with your care. Now, if you scroll back further on, the following New York Presbyterian hospitals and organizations are affected by these contract negotiations. New York Presbyterian Hospital, and it lists all the New York Presby locations. So if you see your hospital here, this affects you. So understand something too. In this letter, they give you an open enrollment period for Medicare Advantage. That typically does not apply to people in group plans like transit or New York City employees, retirees, right? So that is typically for people who are on the marketplace, not group plans or group employer plans. If this is of serious concern to you, where this could potentially be happening, if you are a New York City employee or retiree, you may need to contact Labor Relations. They do always provide you with that once in a lifetime that you can change at any time. You may just want to wait and see what will happen maybe another month, and they'll hopefully have an update that they've reached a negotiation that you don't have to do that. Okay. For transit workers, if you are a transit retiree or a transit employee, this affects you too. This letter actually came from a transit person, and I just got another one from a New York City retiree. So this is out there. This affects you in New York City Transit. Your only insurance plan is Aetna. So that means that you have lost that entire network of providers because your employer and your union put you only in one plan. And unfortunately, your Medicare Advantage population, this diminishes their benefit even more. So that is the rundown on this latest memo. Please keep an eye on it. Make sure that you have a backup plan in case you need to see a physician and that your doctor, long trusted doctor, is not available to you. If you contact your provider that's a New York Presbyterian, this letter doesn't say that they would not accept the plan for payment. Typically, if you're in a Medicare Advantage plan, you have an option, especially in the plan that was been offered to you called the ESA, which is the Extended Service Area Network, where you do have out-of-network benefits. However, still, there are limitations. Unfortunately, you will have to contact your provider and find out if they will accept the plan for payment out of network. If they do not, then you have to pay that provider on your own. Please do that homework now while you can and find out if they do not get an agreement negotiated timely, and you do want to continue to see them, would they accept the Aetna plan for payment? That will help you make a decision on what you would need to do next. And then call your business office or call OLR and see if you have the ability, if you have to use your once in a lifetime, if you're a city employee, or if there's anything that you can do in the transit plan, which I don't believe there is because there are no other plans other than waiving your benefits and coming out, that you can do to help yourself. So please make those phone calls to be prepared. If we hear more information, we will share it with you. Have a good night.